Family Chiropractic in Bend. Thank you so much for joining me for today's webinar on moving through childhood trauma. This is a really, really important topic. Most children experience some sort of trauma in their childhood that they will either carry with them through development and into adulthood, or they will process and move forward in a healthy way. So today I hope to share information that will help you as a caregiver, as a parent, to support your child through a traumatic experience. And I'm going to talk from a couple different perspectives today. So, number one, I'm speaking as a brain based pediatric chiropractor with an immense understanding and reverence for how the brain and the body perceive adverse experiences and how those experiences are lived in a child's life, and how they can also be stored and create adverse symptoms in a child, and how healing body work can be really, really powerful in their journey of overcoming and moving and healing from these experiences. I'm also speaking from my knowledge as having a Bachelor of Science in Pediatric and Adolescent psychology, and with a focus on counseling and trauma healing. I'm also speaking as a mama. I have a little girl who's 4.5 and a 9-month-old little boy. And we just recently went through one of our major traumas of childhood. Our daughter fell from a play structure and had her first major injury. She had a buckle fracture of her arm. So that was something that we moved through as a family and helped her process her trauma from that. And also as parents process the trauma of living this experience with her. So I feel like I learned a lot in that recent experience. And also having worked with so many mothers in our community who have been there with their children through different traumas. And I'm also speaking as a grown woman, as an adult who has done immense amounts of healing from my own experiences as a child experiencing trauma. So I want to kind of give that overview of where I'm coming from. I also am going to open the chat box here. Ooh, let's see, where is the chat box? I actually don't see it today. So, oh, there it is. So chat box. So I know this can be a really vulnerable topic, and whether you have a child experiencing a trauma or this is bringing stuff up for you as an adult of experiences that you had, it's never too late to heal. It's never too late to overcome and integrate and process experiences that we've had that are unfortunate in our lives. So let's go ahead and jump right in. So, what really even is a trauma? So, a trauma is subjective because everybody experiences things differently. But a trauma is basically an adverse event. This can be a frightening event. It's something that, is an adverse event. And so, typically, as a child, for instance, it may cause issues with sleeping. It may create some night terrors, nightmares. They may avoid or have big emotions about being in a similar situation again. Those are typically normal behavioral responses to an adverse, intense experience. However, when those don't naturally through time fade through the routine normal healing process, when those symptoms don't resolve or maybe even get worse or affect their day to day life, we can confidently say that that child has been traumatized. And a trauma can be something like a car accident. So, whether the child is in a car accident, or somebody they know and love was in a terrible accident, or say they're just at the playground and they witness somebody else they don't know in a car accident, that can still create a trauma. A trauma can be a bad fall. Like I mentioned, my daughter fell from a play structure at the park, and that had layers of trauma to unfold. There can be abusive trauma, unfortunately. There can be emotional trauma. There can be grief. There can be so much trauma that can come in different experiences. Some traumas come in situations socially with bullying for kids. That's traumatic. And so there's all different layers, all different definitions of what a trauma may be for that child. But you can accurately say that they're experiencing a trauma if their symptoms from experiencing that trauma are not going away, or they're getting worse and they're impacting their day to day life. And so typically, when you think of healing from some sort of a trauma, seeing a therapist, a counselor is a really, really good thing to do. This is really common, especially when behavioral symptoms are really coming up. We see this often in kiddos after their parents have gone through a divorce, or there's been a major loss in the family, or there has been some sort of major trauma or a move, even a huge change in day-to-day life can be traumatizing for a child if they can't adapt and really acclimate to the changes. And so working with a skilled therapist is highly beneficial, and somebody who's trained specifically in pediatric adolescent development and healing is really, really good. Um, and I want to talk also about the importance of body work in that journey as well. So, talk therapy, play therapy, behavioral therapy is all immensely helpful. And then also working with somebody who understands the nervous system and how traumas are stored in the body, and helping release those traumas and tensions that build up is really, really big. That's what we specialize in here at Pure Light, is understanding the brain and the nervous system, and how every single experience you have in life is lived through your nervous system, and your nervous system perceives and processes those stressors, and also will store an overload of stress that does not get integrated and processed well. And this happens often in childhood. And we have many adults walking around today who have stored traumas and tensions in their body from childhood. But it's never too late to heal and process them. But the sooner we can do it by working with children, the younger they are, the better for their long term expression of health and wellness. So, I also want to talk as a mama and ways that you, as a caregiver, as a mom and dad, how you can support your child through trauma. So you don't need some degree or, immense amounts of sage like wisdom or knowledge to support your child through a trauma. There are simple, effective ways by having a nurturing, loving relationship with your child that you already have the gifts. You already have the knowing that you need to have to support your child through a trauma. And I'm going to give put some words to that and help you have some like practical tips and ways that you can day to day support your child if they've recently gone through a trauma or have gone through a trauma in the past, or you just really want to prepare yourself as a parent, say you have a younger one, to help be ready to help them through a trauma in the future. Okay, so let's go ahead and jump into those. So, the biggest thing is having that warm, approachable, loving, open conversation relationship with a loving caregiver. So, that, like I'm saying, is more valuable in your child's recovery from a trauma than weekly therapy sessions with the most knowledgeable therapist. Counseling therapy, super beneficial and important, but you, as their caregiver, you are their most trusted adult in their life. They want to talk to you more than they want to talk to a therapist, and they need you more than they need anybody else. So you are truly the key to helping your child heal and thrive. And so the biggest thing you can do is to be present, to really give them undivided attention, and to validate their feelings. So in the therapy world, validation is really, really important. So when you experience something in your life and it's traumatizing, for example, you that experience is unique to you, and your feelings are valid. A child's feelings are valid. They may feel like, oh, as an adult, that's not how I would see it or how I would experience it. And it's often common for adults to kind of brush off what a child is feeling and be like, oh, no, it wasn't that bad, or that's okay, let's just move on. No, what they're feeling is valid, and they need to be heard and seen. You want to really pay attention to the details and help them understand what they're feeling. And big feelings are common in childhood, especially when they've experienced a trauma, and big emotions, big feelings can be uncomfortable for everybody. If as a caregiver they're uncomfortable for you, that's likely because you've had some unresolved traumatic experiences that maybe that's how you were responded to as a child, and you didn't necessarily feel comfortable having your big emotions, and the people in your life didn't have comfort with your big emotions. So really, the biggest lesson here is that big emotions are okay. They're not bad. They're the way that your child is telling you that they need more support. So when they're acting out and they're having these behaviors and these tantrums, they're literally saying, "Help me. I need more support. I'm processing this experience and I don't understand it. I don't have the words for it and I need support." So helping calm them, helping be a safe container place for them, and then you can help them find the words that they don't have. So you can try to provide accurate reflections. So when they're explaining something to you about a trauma, you can help them find those words of what they are trying to express while validating them at the same time. Like, "Oh, I understand that must have been scary for you. That would be scary for me too." And letting them know, because big feelings can feel really isolating to a child. And so letting them know that they're not alone in those feelings. Anybody would have an intense experience after what they experienced, whatever it may be. And just really validating that in that sense. And also recognize and verbalize to the child how you understand how the experience that they had is affecting how they're feeling and how they're behaving. So, like, "Oh, I see that you're having these big experiences where you just want to throw things or stomp up and down because of this experience. Do you remember this experience you had? This is related to what you're feeling right now." And helping them make that connection between what's showing up physically and how they want to express themselves and what they've experienced in the past, because children don't necessarily have that bird's eye view understanding. And as a caregiver, you can really be that for your child. So, those accurate reflections help them find the words, make the connection between their behavior, their emotions, and what they had experienced, decrease feelings of isolation and confusion. Because at the end of the day, your child's big emotions and experiences are confusing for them. And if you can provide clarity and groundedness by being genuine and really normalizing their experience and helping them feel seen and heard and loved, you're doing more than any therapist could do, because they are able to therefore calm their nervous system, come to a place where they are seen and heard. And as they get older, they can find the words and reflect and move forward, and therefore those experiences aren't stored deep in their body, in their brain, in their nervous system, which can create adverse aberrant behaviors down the line as they grow if they don't have those things fully integrated and processed. So I hope that all makes sense in that terms. It's really truly that simple in terms of being connected, being present. When your child is having those big experiences, those big emotions, put your phone away, put your phone down. Don't be distracted. Look them in the eyes, get down on their level, be present, be genuine, and be loving. And truly, that is the key to helping your child move through childhood trauma. And then, of course, supporting them through nourishing, enriching experiences moving forward, helping them really move forward, whether it's like, for instance, another experience my child had when she was 3 is she wanted to take some pony lessons. And so we got her into some pony lessons. And there was an unfortunate situation where the pony got spooked and her instructor was just right in front of the horse and did not expect it to happen. And this pony, this pretty big pony, bucked my 3-year-old daughter off of the horse and she went flying. And, thankfully didn't get stepped on by the horse, but she was extremely traumatized. She's only 3. She had no idea that that could happen. And the adults who were with her weren't right there, And so she really processed this. We talked about it. It took months to really talk about it again. And she reached a point where she said, "Mommy, I want to go back on a pony. I'm ready to try this again." And we did. And so really being there when they're ready to revisit and heal and overcome and getting back on the horse again, if you will. And for kids, for example, who are in a car accident, they may not want to go back in a car for a while, and just really, obviously sometimes you have to get back in a car, but not being forceful or frustrated about it, but really being present and understanding and validating their feelings of why they're afraid to get back in the car. They experienced a very traumatic event in that car accident, and it's going to take time for them to feel ready to get back in the car without having big emotions. And that's okay to have those big emotions. So I know I'm being a little repetitive, but I just want to really lay that in that, it's important to be genuine, present, and understanding and validating for that child. So doing all of that, working with a counselor in situations can be extremely important, especially if there has been abuse or really severe traumas. Working with a skilled provider who really understands these things is really, really important as well. And then just to flashback to the body work aspect, this is where we have a lot of our focus and our practice, and I have a lot of passion for. So, a little backstory for me: I started going to a chiropractor when I was like 14, 15, early teens, and I wasn't going for trauma, but I was going for back pain, typically, right? Is what most mainstream people think about chiropractic care. And I had some low back pain. I was an athlete, and my back pain went away right away, of course, when I started getting adjusted. But that was just like the tip of the iceberg. And I had experienced layers of traumas in my childhood that started to unravel. And I didn't fully understand it at the time, but I can reflect back now and see how the body work I received as a young woman was crucial and vital in my healing journey. And I don't think I would be where I am today. I think my traumas would have really held me back in life if I hadn't released them properly through body work. And so I'm really passionate about this from my own lived experience. And we see it all the time in our practice with children. Gentle unwinding of stress and tension in the nervous system releases these layers of traumas that build up. And we see infants, we see newborns, and these newborns receive care because they may have experienced trauma in utero. Every experience that a mother experiences is directly linked to what babies experiencing. A mother's nervous system is literally directly plugged in, if you will, to a baby's nervous system. So if you're experiencing immense trauma or stress in pregnancy, your baby's also feeling that. So there's in utero stress that a baby needs to integrate when they, make their entrance into this whole new world. And then there's birth trauma and stress. So birth can be absolutely beautiful and peaceful and wonderful, but most of the time, birth can be really intense and overwhelming as a stimulus to a baby, especially in our modern world with the birthing practices and interventions that we have. For instance, there can be Pitocin inductions, where contractions end up being beyond the normal threshold of what a mother's body would normally produce, puts immense trauma and stress on a baby. Forceps delivery, vacuum extractions, emergency C-sections, lots of pulling and tugging and stress on a baby can be extremely frightening and scary for a brand new little baby. And then there's the traumas that come up throughout life that through childhood that we had mentioned earlier in the webinar. And so we see children come in with all of these experiences. I mean, we've seen extremes of, adopted newborns coming in here who came from drug addicted, homeless mothers or really abusive parents who have been put into the foster system and then adopted or fostered. And we've seen these children really, really face these experiences and heal in their bodies, and behaviors amplify before they resolve, but really helping them unwind this incredible amounts of physical, emotional, and chemical stressors that can build up in their body. So, really can't stress enough the importance of body work, whether it's brain based chiropractic care like we do. Craniosacral therapy is also very important, and just really addressing the physical, emotional aspects, and also, of course, the counseling and the vital role that you play as a caregiver. So that pretty much sums up everything I wanted to talk about today. If you have any thoughts or personal experiences you want to share, or if you ever want to sit down one-on-one with me and talk about these things, I'm always available. So something I'm very passionate about is helping children move through trauma and heal. So I'm always here, and you can visit us in our office as well. And we really look forward to helping you and your family thrive and heal and be the best you can be. And truly, truly so grateful for you logging on and watching with me. And I hope that everyone has a lovely rest of your day.